thank you everybody who's come to join this session. My name is Sarah Hamayoun, and I'm a spiritual care practitioner in a children's hospice in Leeds in Yorkshire. It's called Martin House, and we cover quite a big region. We cover East, West and North Yorkshire. And we have more than 500 families on our caseload. So I work in the hospice, in the community, and I do a lot of education kind of internally, externally, and that kind of thing. So I've just put this slide in, but it's just really to say that there'll hopefully be some time for questions at the end. But if we do run out of time or you don't get the chance to share your question, then my email is going to be at the end as well. So you can send me anything in email and you can get in touch following the session. So I start this session with a story because I think that's a more interesting way to present. And I'm quite a storyteller, so bear with. So the story is about my uncle. My uncle, he's a software engineer and he's a very analytical person. He's a very logical minded person. And he wasn't ever very deeply religious or anything. But about 6 years ago, he and his wife, they were expecting their first child. And they were very excited and they were just counting the days down. But quite early on, before the due date, something went wrong, and my auntie was rushed into hospital. Doctors and nurses surrounding her, losing a lot of blood. And one of the doctors pulled my uncle aside to speak with him, and he said, we have to deliver the baby prematurely, but there's going to be quite a high risk to both mum and baby. And there's a really high chance that if baby is born, that he would have life-limiting conditions. And they basically made the decision that, you've got to go and try and deliver the baby. So my auntie was rushed off to theatre. And my uncle just remembers feeling this numbness, and he remembers praying. And because he is such a logical minded person, he trusted the doctor's judgment. He wasn't asking for a miracle to happen. He wasn't asking for some miraculous cure, but he was just praying for the strength to be able to get through whatever the outcome would be. So whether that was a life with severe disabilities, whether there was the risk of no life at all, to be able to be strong enough to get through that. And this is that little boy today. So from this, it's not that my uncle became supremely religious after this, but he would always recognize that there was some higher power at that time who responded to his plea for help. And why do I tell this story? Well, it leads to the question of today. Why does spirituality even have a place in healthcare? Why does it have a place in palliative care? Well, it's because of those experiences of helplessness and of hopelessness, which can lead people calling out to a higher power for help. And sometimes you don't access this spiritual realm until you have a need for it. And illness, death, and grief, these are all drastic life changes, major life events that really knock us sideways. And that's when we can sometimes tap into this spiritual realm, our own spiritual realm. And that can be somebody who's held existing beliefs, somebody who's never believed, and even somebody who inherently denied the existence of a spiritual realm. And that's not only for religion. There's also worth recognizing a connection between faith and spirituality and illness, because lots of people search for meaning through difficult times. When they watch somebody they love suffering from a prolonged illness, it leads them to asking why. They have a need for answers. And that's certainly true for people in poorer countries where they face greater poverty. There tend to be people with more faith. Maybe they need something to believe in, to give them hope or to comfort them or to reduce their fear. And it's similar for people in situations of war who often hold on to their belief system even more strongly and in a sense surrender themselves to the will of God or of a higher power It could be a type of coping mechanism for some, that maybe questioning is too painful. And in this sense, you can kind of surrender to some unknown plan that we don't understand the reasons why, but we trust that there is some. So, a little bit about me, just to tell you who's leading the session. So, I've studied philosophy, theology, and religion, and I've done that up to master's level. And I was always interested in questions about life and death, about suffering, about God, about religion. So, I was always drawn to that study. And following uni, I've worked for a lot of third sector organisations. My last job was supporting children and young people who were refugees and asylum seekers. So I've always enjoyed helping people, and I knew that that was something that fed my spirit. So that led me to Martin House Children's Hospice, because it combines all these things that I love, working with children and young people, faith and spirituality, and helping people in difficult times. So I've popped this slide in, and it's not to ask you, but just kind of a self-reflection. This word spirituality, do we really understand what it means? You know, it's a question we can ask ourselves. What defines our spirituality? And what does this word mean to you? Do you think it's just a word for religious people, or does it have a different meaning for you? It might be going to church for some, it might be prayer, like ritual, but it might be singing for others, it might be meditation, spending time in nature, recharging yourself. So it's quite a fluffy word that people often throw around, and but I just want to highlight the kind of individual nature of spirituality and the individual understanding of what spirituality is. So these are some of the words that are commonly associated with spirituality. So you can see there's like connection on there. There is religious words like practices and rituals, prayer, but there's also words like interconnectedness and values, which do not necessarily have a religious affiliation. And it helps to show that everybody has spiritual needs throughout their lives, and that's whether they follow a religion or not. And perhaps that spirituality expresses that life involves something more than biology, that we're naturally driven to seek a deeper level of meaning and fulfillment. And maybe there's certain moments in our life when we come to realize this. Spirituality, it's also understood to be engaged with a quest for the sacred. And that is because the term does have religious roots, it has its origins in faith. But more and more today, it's being used to describe something separate from religion. And you'll often hear lots of people describe themselves as more spiritual than religious. If it is hard to kind of imagine accessing your own spiritual realm, you can think of art. So an artist creates an image and the viewer interprets meaning through their imagination. And art has been described as having the capacity to touch the depths of human experience beyond rational discourse. So we can think of spiritual dimensions in much the same way. It's very, very personal. And the exact same experience could be interpreted as deeply spiritual for one person and not mean much to another. I remember a bereaved family who were non-religious describing when, after the child had died, sitting in the dining room table and a white feather flying in through the window. And for them, that was a sign that their child had passed on and he's letting them know that he's okay. And for other people, that would just be the chance of the wind blowing that feather in through the window. So I have put a formal definition in of spirituality, and that's which I'll read out now. It says spirituality is a dynamic and intrinsic aspect of humanity through which persons seek ultimate meaning, purpose, and transcendence, and experience relationship to self, family, others, community, society, nature, and the significant or sacred. Spirituality is expressed through beliefs, values, traditions, and practices. So some of these words do have religious associations, but practices doesn't have to mean religious practices, and beliefs don't have to be religious beliefs. It could be beliefs about the interconnectedness of all living things or about energies in the universe. It highlights that individual nature of spirituality. There'll be certain words in there that ring true with some people more than the other words. So I put this slide in because there's this other dimension to kind of spirituality and end of life, which I didn't used to include when I delivered these, but the more kind of stories I heard and the more I speak with families at the hospice, I thought I would mention it because in some cases it has quite a lot of power for families. And that's this idea of this spiritual realm where people pass on to certain phenomena that seem hard to explain in purely biological terms. So some experiences for families are so strikingly consistent and vivid that they're interpreted as evidence of the spiritual realm. And that can include the deathbed visions where many dying people report seeing relatives or friends who've already passed who appear and call them. And they describe these visions as comforting, not frightening. And these have even happened at the hospice where I work. There's terminal lucidity, which people talk about, shared death experiences where people at the bedside feel or sense something at the same time at the point when somebody dies, such as sensing a presence or a bright light. And even some dying patients describe seeing people they didn't know had passed away. For example, a child seeing a deceased sibling and speaking about that, which has happened in the hospice when one of the mums had miscarried and the child spoke about seeing their sibling. So, obviously, from a scientific point of view, none of them conclusively prove a spiritual realm, but they're really powerful for the families. They're really important. They remain deeply meaningful to those who experience them. So, these are not really aspects that come under spiritual care that we explore with a person, but they do come up quite frequently, and they especially come up in non religious families. So, it's just to kind of have that awareness. So, we'll come to the place of spirituality within paediatric palliative care. So, spiritual care, it's now being recognised more widely as part of the multidimensional needs of patients, as being essential for a holistic care approach. And the research is increasingly showing that religion and/or spirituality has positive effects on the health of palliative care patients. It supports them to find meaning and purpose. It provides hope and comfort. And even in children, it's been shown to improve coping with hospitalisation, with treatments, and with fear of dying. So we might ask, do poorly children even think about death? And many people, including the family members of poorly children, they often want to protect children from thoughts about death and from discussions about death. And then we assume that if they're not asking directly, they're not thinking about it. But the honest answer is that many poorly children do think about death, often far more than we realise, and they just don't always think about it in adult ways or express it in adult language. So children who live with serious illnesses, they're surrounded by cues. They experience pain, they have repeated hospital stays, they're around medical language, they witness worried adults, they see their parents crying, they have drastic changes in routine, and sometimes they see the deaths of other children. So even very young children notice when something is different or when something feels frightening. And some of the children think about death explicitly, and they might ask direct questions like, am I going to die? Will it hurt? What does heaven look like? And others think about death indirectly. They might ask, who will look after mum when I'm gone? Can my toys come with me? And some children don't ask questions at all, but their fears might be revealed through their behaviour or their play, their drawings, or even their silence. And children also take their cues from adults. So when death feels like this unspeakable thing, children often learn to protect the adults around them by not asking, even though those questions are still there inside them. So what's important to understand is that thinking about death doesn't harm children, but what harms them is being alone with those thoughts. When we gently acknowledge their fears, when we listen without rushing to reassure them or correct them, we give children permission to explore what they already sense. It's not that we put those ideas into their head, we simply meet them where they already are. And we can offer them a compassionate presence, honesty, and the reassurance that they don't have to carry those thoughts alone. And as many people who work within this field recognize, I think Emma just talked about it perfectly in the beginning, it's really important to remove that fear about death and dying and open up those conversations, because there's many situations where the parent wants to kind of withhold that information from the child and not have those discussions openly, and not have the discussions in the same room as the child, when the child actually knows a lot more than they think, and when you're alone with them they talk very openly and honestly. And actually the children who've been living with prolonged illnesses, they're like old souls. They're very mature, and they can talk about it, about themselves dying, in a much less emotional way than their own parents can. And it's just, I guess, the way that children process it as well, and the way that they reflect on these things. They're much more willing to have that open conversation about it. So we will see later some examples of spiritual distress or spiritual suffering, and how it can present in different ages and abilities. But what does spiritual well-being look like? So this is something we can all understand that we need to nurture. So for some, it might be feeling that life has a purpose and a direction. It might just be as simple as experiencing peace within yourself, or having a sense of connection to something, whether that's to the people around you, to nature, or whether that is something larger than yourself. And it could be, for some, living in a way that feels authentic and aligned with your values. And for religious people, there's like these phrases called positive and negative religious coping. So, positive religious coping, this is when religion or the person's spirituality helps somebody adapt constructively to stress, to change. And it's associated with resilience and recovery after trauma. So that might be seeking strength in God, for example, or in a faith community. It might be in a specific ritual like prayer. And there's negative religious coping, which is when religious beliefs or experiences increase distress or guilt, or when faith feels like it's breaking down under pressure. And that often appears during crisis, trauma, or loss of meaning. So we see a lot of that in the hospice. We see both sides. We see people leaning on their faith strongly, even to the point of praying for miracles, praying for cures. And we see people turning away from previously held beliefs or previously held rituals that used to play a very central role in their lives. So when we think about for care for children, we're talking about the active total care of the child. So that's the body, mind, and spirit. And it involves giving that same support to the wider family. So we're making that support system around the child strong as well, so they can all hold each other up. And ideally, it should begin when the illness is diagnosed. That's when we would get a referral for a child at our hospice. That's when we would meet the family. And then that support would continue throughout the child's life, and then it would continue with the family after the child's death. And studies have suggested that spiritual well-being positively affects suffering at end of life. So it is really important to people, and it can make your job easier if you nurture their spiritual well-being. So we're going to come to spiritual needs and kind of how they present in adults versus children. So you can see that for adults, a lot of the time we can have spiritual reflection. So I work a lot in bereavement as well. And that's, spiritual reflection. It's bereavement counselling, it's talking through, and they're much more able to kind of express themselves. But for a child whose mind is not that matured yet, they don't have that language to be able to communicate those things. It might present itself more simply. So whereas for adults, you might see them trying to make sense of illness, trying to make sense of suffering, or talking about mortality. At end of life, adult patients are often reflecting on their life story, on their legacy. They might bring up regrets and forgiveness, unfinished business. They might reevaluate previously held beliefs, and they might desire to be remembered meaningfully. Whereas for children, it could be as simple as knowing that they're deeply loved and deeply valued. They might want to understand their illness through play, through story, imagination, and try to make sense of what's happening in more concrete ways. Sometimes they want reassurance that the illness is not their fault. And oftentimes they just need a calm and attuned presence rather than a lot of explanations. So for children, often we go into hospitals every Friday to sing to the children on the wards. And oftentimes they're just hoping for that comfort, for fun, for connection, and for a good day. It's not that children are less spiritual than adults. They're often more spiritually perceptive, but their spirituality is lived through relationship, through play and presence rather than words. And spiritual care for children, it's less about answers and it's more about being alongside them in their experience. So we can look at now, what does spiritual pain look like? So these terms that we use, spiritual pain, spiritual distress, how do we diagnose this pain? So we have a doctor for biological symptoms. You want to talk about pain and nausea and appetite, that's where the doctor would come in. And we have a psychologist for symptoms of depression, for anxiety, for suicide. We might involve a social worker to support a family with financial burdens or caregiver responsibilities. But very often, very sick patients will have symptoms of hopelessness, conflict of faith, being angry at God, wondering what's after death, or feeling a need to connect with something sacred. And this is where you'd call somebody who is able to create a space for those conversations and who can guide the person through their own belief system to ease their spiritual suffering. And that experience of loss of connection and meaning, that's something that we call spiritual distress. So that's part of my role, to kind of identify the signs of spiritual distress and support them through it. There was a recent study on spirituality and supporting families with seriously ill children, and nurses witnessed families who were angry with God and having a need to talk about that anger. They witnessed families experiencing feelings of blame and regret for not finding a cure or for not seeking care earlier in the child's illness. They were dealing with younger siblings, asking them difficult questions like, why hasn't God fixed my sister? And parents with faith struggling to answer those questions. So it shows that there's always been signs of spiritual distress and spiritual suffering, and only now it's being recognised and addressed correctly. So these are some phrases that you might hear that would indicate spiritual suffering. So you can see they've kind of grouped them into areas where it might be indicating a loss of meaning or a loss of hope, or that feeling of helplessness, that feeling of having no power. So these kinds of sentences might invite spiritual reflection, and it's necessary to have a person there who's got the confidence or the resources to be able to create a space for these questions. If we're talking about really small babies and infants, at that stage, spirituality is about felt safety and felt connection. So babies experience spiritual well-being through rhythm, touch, voice, and presence. And when an illness disrupts these, distress can emerge. So spiritual care is here, it's less about doing and it's more about being. So it could be holding, soothing, singing, gentle rituals, and a kind of consistent presence. And we've actually seen that many times in the hospice when we've had a shift in the baby's health when they move from hospital to hospice. So when they can leave the NICU and the PICU and they can come to the hospice, we've seen drastic changes where they've come for end of life, but they end up going home. So we can only kind of speculate, but there's an idea there of maybe, the lighting and the sounds and the pace of of the hospital versus the hospice, and being able to be held and being soothed in that environment. For non-verbal children, so a lot of the children at our hospice are non-verbal, and they often express spiritual distress through their bodies and their behaviour rather than speech. So that might include withdrawal or disengagement, changes in facial expression, movement, or eye contact. And it's important to speak to the people who know those children really well, and it's often their parents, and they can often tell you when the child's uncomfortable or unhappy or something's bothering them. So for non-verbal children, spiritual distress, it could stem from feeling overwhelmed or feeling misunderstood, a disruption to routines that give them meaning and give them safety. So for here, where you would give spiritual care is through a deep attunement, so noticing patterns, honouring preferences, offering sensory comfort, and recognising that communication is happening even when words are not. And we kind of use a phrase that we call that silent spirituality. For younger children who are verbal, they often think in more concrete and imaginative ways. So they have kind of magical thinking, expression through play, stories, drawings. But their fears could come out in questions as well. So you might be asked, am I being punished? Who will look after my toys? And these questions reflect a search for meaning and reassurance. And spiritual care at this stage often involves spiritual play, storytelling, gentle language, and helping children feel seen and safe rather than correcting their beliefs. And then young people who are verbal are often the most visibly spiritually distressed and sometimes the hardest to reach. So they might experience anger, rage, bitterness, withdrawal, silence, refusal to engage. They might be questioning their identity and purpose, feeling different, feeling isolated, robbed of a future. And common questions I hear is, why me? What's the point? For young people, illness can shatter that identity, that autonomy, and their imagined futures. So it's often tied to that loss of control, loss of independence, loss of meaning. And spiritual care involves respecting autonomy, listening without judgment, allowing difficult emotions, and being present without trying to fix or reassure prematurely. Spiritual distress in children and young people, it can often appear as a crisis of identity. So that loss of sense of self, that loss of meaning, and sometimes a fear of dying. And if we use appropriate methods according to their age and their abilities, we might explore that distress. So with very young children, it could be through spiritual play and art. For non-verbal children, it might be through music. And for young adults, it might be spiritual reflection and counsel. And then we use those same techniques with siblings, parents, and other family members who are also affected. Children's spiritual distress, it might appear more simply because their spirituality hasn't had the time to mature. So it's about finding the simplest words to help them explain how they're feeling and what might comfort them. Something we use at the hospice is a training called No Barriers Here. And it's an external training that you go and do and you come back. And it helps children to design a tapestry where they can essentially plan their funeral. And it sounds quite morbid, but it's actually a really kind of pleasant activity. And it gives the child a lot of control, a lot of autonomy, and it creates a space for them to talk about that and to talk about what they want and whether they want the teddies there and who they want around them and what music they want and all those kinds of things. So that helps them, it provides them with a mode for communicating their spiritual distress, and it does it in a way that enables the family around them to be able to talk about it as well. So current research shows how children present their spirituality in creative thought and play, in wonder, fascination, and mystery, where adults usually interpret children's narratives merely as fantasy or play. There might, in fact, be deep logic available to children through them dwelling in their story worlds. So sometimes we might just dismiss something, but actually for children, that's how they're going to explain, that's how they're going to communicate what they're thinking about. So I've put a definition of compassion in as suffering with. And I think a big part of spiritual work in paediatric palliative care involves compassion, an ability to sit with that person in their suffering. And that's how you can do spiritual work. And that's how spiritual distress is challenged. So that's kind of your first port of call, which people who work in these environments are always doing. They're always practicing this. So they're always practicing this element of spiritual care. And Reverend Paul Nash, who I'll come to in a minute, who's quite a pioneer in paediatric palliative care and spirituality, he describes the work of chaplains as not fixing people, but sitting in the crap with them. And it sounds quite indelicate, but it's very true. It's being able to sit in that. And I've put it in quite a different way. So I've put this image where you're imagining a tunnel where the light is barely visible at the end. The chaplain or the spiritual care practitioner, it's somebody who accompanies them in that darkness. All they're doing is holding their hand in the midst of that storm. And through that relationship and through that, giving them time, you're identifying the signs of spiritual distress, and you're identifying inner resources of strength and healing and accompanying them through their personal journey. So this again is about compassionate presence. So this is a phrase a lot of chaplains will use, and it's this idea of listening versus fixing. So being mindfully present and not worrying about having to provide the answers, but just being there. So I think some people are often afraid when people are asked, why has God done this to me? Why? And they feel that they have to be able to answer, but nobody has those answers. Not even the chaplain has those answers. So it's about sitting alongside them through that. So there's compassionate care, and that can involve empathy, forming connections, helping patients with issues, and being respectful and caring. But presence calls upon another set of skills in which the clinician moves to a more reflective and contemplative space with the patient. So we describe compassion as spirituality in action. And if on this image you have the left person who's coming ready to create a safe spiritual space. They're coming with openness, ready to hold that person spiritually, observing cues in the person and exploring those further. And on the right, we have a person who's nervous. They have inner feelings of uncertainty, but they want to release that pain. They want to reflect on what's happened. And this is a really simple way you can embed spiritual care in your place of work if you don't have a chaplain or a spiritual care practitioner in place. And we recently had a mum who she'd come in for end of life, and her son, he was going to have a compassionate extubation. So we planned it exactly how she wanted. We have a kind of sanctuary space in the garden, and she wanted to do it at sunset. So we planned everything, and surprisingly, the baby ended up being okay. But it was afterwards when I went to speak with her, she described putting herself through all the emotions, all the expectations of loss, then rebuilding hope and reflecting on what had happened to be able to process it. And she was emotionally exhausted, and she was describing, having to prepare herself to go through that again for what the future might bring, as her child still had life-limiting conditions and the diagnosis wasn't good. So it's just about being able to create space for those people to let out what they need to. So I've popped this in. So the chap in the colourful shirt, that is Reverend Paul Nash, and he was the lead chaplain at Birmingham Women's and Children's Hospital. He's now retired. So I've put this in to tell people to make use of their chaplains and make use of their spiritual care practitioners. So I'm currently studying now a master's in chaplaincy at the uni. And that's the course designed for chaplains, for spiritual care practitioners who are in post to practically apply their theory to the work. So rather than being a chaplain sort of certified by a specific religious institution, we become academically certified. So that's the difference kind of between a chaplain and a spiritual care practitioner. It's essentially the same principles, the chaplaincy principles, but the key difference is that chaplains are coming from a specific faith background. So you'd have a Muslim chaplain, a Christian chaplain, and a Sikh chaplain. And Reverend Paul Nash, he's set up a whole centre which you can find online, and they have many resources, like fantastic resources, especially in the field of spiritual play. So that's really useful for people who are in post and can actively use them, but particularly for those who don't currently have somebody in post advocating for spiritual care. It can help kind of give you ways to open up those conversations. And it's worth mentioning that chaplaincy has changed, and whilst it was previously heavily associated with Christianity, and those are its origins, they're now chaplains from every faith and spiritual care practitioners for people, because now many people describe themselves as non-religious. So we want to make spiritual care accessible to all, because everybody faces spiritual dilemmas, and that's whether they have a religion or not. There's also this idea that chaplains are only to be called upon at the end of life or at the time of imminent death, for example, to read out the last rites or to anoint you. But today the research has revealed the value of nurturing our spirituality early in the illness and throughout. So the idea of what a chaplain is and does has evolved. And I think the important thing is that chaplains are one of the few staff who have that time. And I've often heard that from families, that other professionals, and that's from doctors and nurses all the way to mental health professionals, that they have kind of allocated sessions with people and scheduled time. But when the chaplain goes in, they know that there is no agenda here and it's kind of a safe space. So they really kind of open up in those spaces. I've popped some tools in here. So when the recording goes out, I guess you can pause these and have a proper look. So this is the FICA spiritual tool. And these are just quite useful. This is quite a detailed version of the tool. There is a much simpler version, which the nurses and care staff in our hospice would get them on small printouts so they can keep that in their pocket. And it just allows people to think about what sort of questions open up spiritual reflection. And it's not that you would go down and ask all of these questions. It'd just be to use them as a guide and to kind of feel a bit more confident. Because what we often find is, in the moment, the person would open up with whoever was there. And we've had that even with housekeeping staff and kitchen staff, having this huge question brought upon them, and not knowing what to do with that. So feeling like they don't want to dismiss it, but they're not sure how to create space for that spiritual reflection. So these could be some of the questions that open up the doorways for people. And this is a second popular tool called the Hope tool. And it's similar structure to the FICA tool, with a few different questions. So hopefully those will go out when the recordings go out and people can check them. So I've put this question in. So Reverend Paul Nash, when he wants to kind of simplify understanding spirituality, it's like asking what lifts your spirit, what makes you soar, what soothes your spirit. And that's how you get to the crux of finding out what's really important to the person. Because on the opposite side of spiritual distress is our spiritual resources of strength. So in my role, that's what I'm trying to do, is to help the child or the young person or the bereaved family to identify their individual spiritual resources of strength and rely on them to lift and soothe their spirit. So everybody has these. If you think about really, really difficult time in your life, and what did you use, what did you lean on to kind of get you through that? For some people, it's something practical like a meaningful ritual or practice like a prayer or meditation, or it might be a concept like acceptance, surrender, forgiveness. Everybody has these inner resources of healing. And we can think of religious rituals that are spiritual practices like prayer, the rosary, fasting, reading mantras, reading scripture. But there are also non-religious spiritual practices like yoga, dance, meditation, focusing on a landscape view, listening to the rhythms of the sea, music, poetry. So these are just to give you an idea that where perhaps a cure for physical suffering is not possible, there is always a space for healing. So feeling a sense of acceptance or peace, it leads to a good death. And that's what we're aiming for in this line of work, I guess. So these are some quotes. I'm just conscious that I want to leave some time for questions. These are some quotes that mums have said to me recently. So everybody has to be able to frame an understanding for their suffering. So whether that's a trust in a God, or whether that's that life is a series of tests, whatever helps them to cope and understand why this is happening. And these insights are really useful. So the one at the top, where the mum has described caring for my poorly child as a form of worship for me. And this mum, after her child was bereaved, she kind of reframed. When he would cough in the night, she would always wake up because she feared that he would aspirate. And now when she looks back on it, she thinks every step that she was making towards him. And in that time, she felt annoyed about having to wake up. Maybe she felt tired. But now when she looks back at it, she describes every step she was making towards his room as a step closer to God for her. And these kind of insights help you, because if you meet mums of similar religions or similar faith, I've met Muslim mums, for example, who were really upset because they don't have time to fulfill the 5 daily prayers. Their care duties just overtake their lives. So I might describe to her how this mum has framed her devotion. And it's just a different way of looking at things to provide some comfort for people. Other mums seeing hardship as an opportunity for growth. So those are the two comments. They're quite similar in that sense, but one is with the angle, the angle of God, sorry, and the other one is without being religious. There is a lot of families who turn to faith at end of life, even when they are not religious. And sometimes that's because that set of rules can offer comfort. So we've had lots of non-religious families who come in for end of life and they request a christening, which we do as a kind of naming ceremony as the child's already passed. But we get really positive feedback from that at the end, and the families feel that that's just what they needed at that time. And it's for some people, they've grown up in certain religions, but then they don't identify as religious, but they still often have very religious burials and services, very religious end of life rituals. And it might be because of that familiarity and that comfort. It gives them some structure. And there's certainly this idea in Judaism, for example. So in Shiva, after the person dies, they have these periods of mourning. So they have Sholshim, which is like a 30-day mourning period. And if you lose a parent, that period lasts for 11 months. And these structured periods of mourning, they help to provide support through the grieving process. So the framework might sound strange to a non-religious person, but many religious people feel that the frameworks actually allow them to be released from the grief and re-enter the world. Obviously keeping the memories of their loved ones with them forever, but it reminds them to return to the present life. And you should also feel comfort from that as medical professionals, that religious families and often rely on these religious rituals and the religious communities that they're part of to come forward and guide the family. So you can kind of take a step back and not have to worry about doing that. And that's why it's really important to make connections with local faith leaders, with chaplains, pastoral support workers, especially the ones who do more community engagement with children and young people, because they can come and lead families through the family's faith. So obviously in the role we work with families of different religions, mixed faith families, no faith families, explicitly non-religious families, and that can bring all of its own stuff with it. Sometimes we're navigating tensions between the child and the family and their individual belief systems. Sometimes we're supporting parents facing anticipatory grief and existential pain. And there's also an awareness of cultural sensitivity and end of life. But I think it's really important to remember that people don't fit into one box, that everybody practices their faith differently. So you might meet Orthodox Christians who wear headscarves. You might meet Muslims who don't eat only halal, or people who identify as both religious and gay. And everyone has different levels of religiousness and religiosity. So it's important to learn just how important it is to them specifically. Is it a major part of their life? Do you see them praying? Do you hear them playing gospel music, for example, or referring to God? How could you recognize their beliefs? How could you support them? Could you show them where the prayer room is? Could you ask them if they want to speak to a chaplain? Could you ask if they want somebody to pray with them? It's important that we don't make assumptions, but that we take the time to figure it out. And it's also really important to recognize if the children share the same beliefs as the parents. And this can cause a lot of friction, especially towards end of life, if the children or young person has non-traditional wishes. So it's important that these are discussed openly, and sometimes the chaplain can help facilitate these discussions. So we, at the hospice, we bring people in to share the significance of certain rituals and the meaning behind it. And increasing that understanding reduces the fear of the unknown. And we also try really hard to have inclusive resources for our faith room. So rather than just kind of ticking a box and having, a Bible and a Quran, we focus on what do the individual sects within those religions use. We might bring Shia objects for prayer, like the turba. We support Polish families, so we bring a Polish Bible. We try to bring resources that would promote healing through the religious lens rather than just the religious book. So that's actually something that would be useful for the families. So we try to get books around understanding death, and those can be written for children up to adults through the lens of their faith. Sometimes that's how families want to teach the living siblings about what had happened to their sibling. So spiritual care practitioners, we work alongside every person within the organisation. So I'd work alongside nurses and care team, support with filling in advanced care plans. I often work as a bridge for doctors and consultants, and being around when doctors are explaining certain diagnoses, helped facilitate discussions around organ transplantation for certain religious families, worked with social workers, family support teams. And there's a lot of overlap. So where maybe indicators of poor mental health and then signs of spiritual distress, they can often present similarly. So it's about identifying which support would suit them best. I work closely with play specialists, exploring spiritual play. Again, you can look at the Birmingham resources, but one of them that they have is called the Roots Pack, and it's a pack of cards in 3 different colours, starting with easy questions, more difficult questions, and then religious-based questions. And it's good for opening up conversation. We use them when we go on hospital visits as well. And then we work in bereavement and counselling. So often for families of faith, processing their grief comes through the lens of their faith. So it helps them to speak with a spiritual care practitioner so they feel more understood. And this integration allows spiritual care to contribute insight into a child or family's emotional and existential needs. It provides a fuller picture of the person, of what's important to them and what they'll lean on to get through difficult times. It also helps staff understand behaviour or distress that might have a spiritual dimension. So we've had even cases of, for example, we had a family who the mum, she believed that she could contact kind of mediums, that she was a psychic. And when her child had died, she believed that she would still be able to communicate with her child's spirit, so that the physical body was just an empty shell and she had no kind of connection with it anymore. And she ended up like leaving the hospice early and leaving us to kind of figure out a burial or cremation. And I remember a lot of the staff really struggling with that and thinking, how can she be this way? And it's really important to create spaces where we debrief and where we try to understand people's beliefs better. And it just reduces that fear of this unknown thing. We've had cases at end of life where religious families don't want to use certain drugs that would provide comfort in the last moments of life. And that can be really difficult for nurses and for care staff who feel that the child's maybe struggling, maybe they have agonal breathing, and they want to be able to communicate this. And it's really, really difficult to facilitate in those situations. But again, debrief, education, speaking with the family beforehand when you're planning for these things, and maybe involving a chaplain or a spiritual care practitioner at that point to facilitate those conversations, even if it's just to prepare the staff for moments like that. And it's not that spiritual care should only be reserved for moments of like crisis or for the time of death, but it can be helpful at diagnosis of the life-limiting condition, at times of transition, when families are asking big questions, when the distress feels more than purely emotional, it feels existential, and then of course at end of life and into bereavement. So it might not sound directly like a religious referral. It might be that you might get a referral that sounds like this family is struggling to make sense of what's happening, or this young person has been asking questions about dying. So it could just be something like that you'd bring in the spiritual care practitioner or a chaplain. I'll just check the time. I'll quickly just run through this story then. So this is a little girl and her family. They came to one of my chaplaincy classes to share their story, and the family is given permission to share it. And I did have a video, but I'm not going to show that in this because there's not enough time. But I'm just going to share a kind of small part of the story here because I think it can help to illustrate the role that faith plays in some people's lives. So a little girl that they call KK, she had a heart defect and she had to have a heart transplant when she was 6. It was deemed really unlikely that she'd survive post-transplant, but she pulled through and her life returned somewhat to normal. But more recently, she'd got diagnosed with cancer, and her mum shares how that experience was for them. And the mum is describing the moment when the doctor's in the room and he's giving her information and he's handing her leaflets and he's asking if he needs to explain anything else in more detail or where she can get help and where she can get support for different things for. And then he finally asks her, what do you need? And mum, in that moment, she says, I need a word from the Bible right now. Like, there'll be a time when I look at all of these leaflets and when I read all of this information. But right now, in this moment, I need somebody to give me a message of hope. I need, I need words of scripture and I need to pray. And because she was able to communicate that, then the chaplaincy team at the hospital where KK was at were really heavily involved with the family. And she sings their praises. And the mum was talking about how the faith carries the family through their trials. So it's understanding how significant a role faith and spirituality can play in a family's life. It could be central to kind of all of their decisions from the point of diagnosis to even when the child dies and afterwards. You have some families who they're praying on a miracle, they're praying on a cure, and sometimes the child dies. And afterwards, if you speak with those families, it can go one of two ways. Some of them lean on their faith even more strongly and they say, maybe there was a reason in this and we trust in God's will. And other families turn away from God, turn away from their faith. So I'm sure lots of people have faced barriers and situations like that in their places of work, dealing with families of different beliefs. So I'll be happy to hear about them. And that is the end of my presentation. But I will just also point out that we run a spirituality sim day at Martin House. So if anybody is interested in joining that, they can email me. So that's a whole day of simulations where we have actors acting out from different religions, kind of scenes of spiritual distress, and healthcare professionals can interact with that. And it's a really good day with workshops and that kind of thing to help